Welcome to my podcast. Today I'm going to talk about another common case seen in the elderly men. So basically, after you introduce yourself, as always we agreed, and double check the patient name, date of birth, an old man walk into your clinic and state that he has an embarrassing situation and he's not quite sure what's going on. And he will state that it's been for a while, like 2 to 3 months, and it's persistent, and he's not quite sure what's going on because obviously the man is in monogamous relationship. He's married, and he's not doing anything that might make him like suspicious for something. So basically, you will tell him what about. The patient will say it's in the tip of his organ, and it's persistent and slightly tender, but it's not itchy. There is no burning. He will say, I go to the toilet, I'm okay, I don't have any burning when he wee. And he has no history of lower urinary tract infection, no history of discharge. He's otherwise fit and well. He tell you that he never had any sexual transmitted infection before, and the only thing that he's on is aspirin and statin because he has a history of heart problem for which he's taking treatment. And apart from that, his skin, the rest of his skin is normal. There is nothing wrong, and has no diabetes mellitus or hypertension or any disease that could run in the family. And he's not quite sure what's basically the situation, and that's why he's a little bit worried and concerning and came to you in the clinic. So you'll tell him, do you have anything in your mind that you are really bothered about or worried about? So the patient will say, oh, I'm not quite sure, I'm old, maybe it's cancerous, maybe it's something that's sinister. Just want to rule out what's going on and just want to make sure that there is nothing wrong that mandate later on further investigation and medication and treatment. So you will tell him, okay, that's fine. I would like to have a quick look, if that's okay with you. And of course, he will ask about his lifestyle, what work does he do. He will tell you, I'm retired, I'm fit and well, I do some exercise, I go for walking. You will ask about the drink habit and the smoking as well. Because of that, it's very important as well, and his social status, who live with, and you take it from there. And then you will tell him, I would love to have a quick look. So obviously, if you are in opposite sex, you will ask for a chaperone. If you are in the same sex, you will just double check that if he's fine to have a quick look, and if you need to have someone else, in the room, like chaperone, as I stated. So you will have a quick look. You will see a red rash, obviously in the tip of his organ, in the prepuce area, and it's a little bit thick. It's a flake or a batch-like, and you will examine, of course, the organ, and you will examine the testis, and you will examine the lymph node in the inguinal area, and examine the whole skin just to make sure that there is nothing wrong, and you check his observation, as I say. And then you will tell him, okay, thank you very much for that. I just need to agree about what I'm thinking of and for the management plan. And before doing so, we would like to have some investigation just to make sure that everything is okay. So we will arrange for a urine dip test, which came out normal. You will do also for a swab, which came out normal as well. And you'll do scraping just to rule out herpes and serology for syphilis. And then you need to think about what could be anything that could contribute to this red, shiny, red rash in that area. And of course, you have to know, in the Muslim world, we know men are circumcised. But apart from that, most of the men in the West, they aren't. So basically, you need to put that in mind and think forward how to come up to the right diagnosis or to the differentiation and rule out what could fit really with the history. So as I say, it's persistent, it's red, it's shiny, and it's flake-like. So the first thing you're going to think of is psoriasis. Psoriasis could be one of the things that lead to such presentation. And the patient will say, I don't have any history of skin problem. So it could be what? It could be flexural, and it could be just in that area. The other thing you need to think of is tinea crurus as well. So tinea mostly it's itchy and it's red as well. It can be shiny as well in the crural area and the fold, body fold. So that's another thing. So you might send them away with antifungal treatment like hydrazole, miconazole, and with hydrocortisone as well for 1 week, 2 weeks, and tell him if it doesn't resolve and if you don't feel any better, just come back again and we will take it from there. The other thing you need to think of, it could be infection as well. So if there is any tenderness, as the patient says, it's slightly tender. If it's oozing, for instance, if the patient's feverish, maybe it's early stage, so it's just tenderness. So you will assess that by your eye, by your naked eye examination, and you will take it from there. And if there is any, for instance, infection around that area, folliculitis or something like this. The other thing you will think of dermatitis as well. So you will ask the patient if he had wear, for instance, a new underwear or trouser that could be related, because in that sense, you will ask the patient if he had any thought. So the patient might say, oh, when I tried that thing, I just got this sensation. So in that sense, the patient knew what's going on. The other thing you will think of, obviously, with the patient, as I say, is elderly, so you will think about malignancy as well. So I need to rule out that, and you will arrange for bunch biopsy just to check what's going on. And you will think about another thing which is called zone balanitis, which is another inflammatory condition seen in elderly men. And it's predominated by plasma cell infiltration, so that's another condition. And then you will ask the patient, you will examine the prepuce and the skin fold, the foreskin, and see if it's clean underneath, because sometimes under the skin fold or this foreskin, there will be like debris which accumulate and could cause friction, and the hygiene will be inadequate, and this all will cause irritation, and obviously to the mucosa, which could lead later on to urinary retention. And obviously the patient here doesn't have any dysuria, he's weeing okay, so that's not the condition. However, you can advise in regard. And then you will treat it, obviously, medically, and if it doesn't, for instance, improve or any of that, there is another way, which is a surgical approach in certain situations. So you just need to take differentiation stepwise and try to come to a conclusion, what's going on, what's the condition, how can move forward. And if it's a condition that related to the foreskin, you can advise the patient that he can arrange for circumcision in order to get rid of the foreskin. And this will stop causing and recurring of the issue in that area. So I hope by that I just covered one of the cases you could encounter. Especially, it could happen anywhere, especially with Western men, with the foreskin and the issue of the circumcision, which could be another thing to think of and take it into consideration when you are trying to find out the differential. And of course, always safety net your patient for any red flag symptom, and tell them to come back if it doesn't feel right, or if it doesn't improve, or if you have anything that you are worrying really about. And I see you in another podcast. Thank you.